Have you heard of COVID long haul and wondered what it is and if it could affect you or your family? My name is Lisa Oyer. I'm with the Columbus Medical Association and I work with physicians every day. But I'm also, like many of you, I'm a mom here in Central Ohio, trying to keep my family safe and somewhat sane. Today I'm joined by Dr. Laura Gravlin. Dr. Gravlin is a cardiac electrophysiologist at Mount Carmel Health System. She's also the co-director of their Women's Heart program. Today, she's going to help us better understand long haul COVID. Welcome, Dr. Gravlin. Thanks for joining us today.
Thanks, Lisa. I'm really excited to be here, and thank you for what you and the Columbus Medical Association do for us all.
Absolutely. So, first off, could you just help us understand exactly what long haul COVID is?
Sure. Long haul COVID or COVID long haulers, it's actually a term that was coined first by patients. What was happening is patients were infected with COVID. They would go through the usual infection period and be recovered after 2 weeks. However, a group of patients continued to have symptoms, and they found each other on social media and started talking about long haul COVID. And what this is the persistence of symptoms even after this normal recovery time. Symptoms can be mild fatigue or very severe incapacitating fatigue. Folks describe shortness of breath, elevated heart rates, nausea, vomiting, intermittent fevers, and these symptoms can be relapsing and remitting. Dr. Fauci has described this as a post-viral syndrome, and there are some virologists who have suggested calling it a chronic COVID syndrome.
Interesting. So, what are you seeing of long haulers in your cardiac practice?
Yeah, so when we think about the heart, we think about it in a number of different ways. It's a series of pumping chambers that has valves. It's a plumbing system. So when people get blocked arteries, those are people who have heart attacks. And it's also an electrical circuit where the circuit flows in a certain pattern so that the cells twitch and the whole heart pumps. And all aspects of this can be affected by COVID. We can see inflammation called myocarditis, and that can sometimes have lasting effects. We can see weakening of the heart muscle called heart failure, and again, that can have lasting effects. And sometimes we can see triggering of abnormal heart rhythms like atrial fibrillation or even more severe heart rhythms that come from the bottom chambers of the heart or ventricles.
So, how do you treat your patients for long haul or physicians in general?
I think as it relates to the heart, we're seeing elevated heart rhythms called tachycardias, and we can use the medications to help with that. And in rare instances, procedures called ablation. Heart failure, we would manage that with medications as we typically do in our heart failure clinics. And then for people who have myocarditis, that's an inflammation of the heart, and there are some medicines to help with that. With regards to myocarditis in particular, there was a subset of athletes who had COVID that had myocarditis, and that actually delayed the start of the Big Ten League. There is a risk of dangerous heart rhythms that can result in something called sudden cardiac arrest. And so for these folks, there should be good conversation with their physicians and consideration for EKG screening and perhaps other imaging modalities to look at their heart function.
So, how long is long for long haulers?
Yeah, that's a tough question to answer because honestly, the pandemic has only been going on for a short period of time, although we all feel like it's been forever. And so we don't know if this is going to be weeks to months or if some people are really going to endure symptoms for years. There are a bunch of scientists and medical professionals looking at registries and databases to try to help answer these questions.
Are long haulers still contagious to others?
That's a great question. So what's being reported is that most people are no longer contagious after 10 days, and certainly the majority of people are not contagious after 14 days. That can be confusing because you can still test positive 12 weeks out. Well, you can still have the virus in the nasal passages, but that virus is no longer able to replicate, no longer to infect somebody else.
Are the people with the worst COVID symptoms more likely to end up with long haul COVID?
That's a good question. You can have mild to moderate symptoms and still have significant long hauler symptoms. What we do see, women are 4 times more likely to be long haulers. And what's not been reported just yet is if there's any racial disparity. We know that that's been an issue with COVID in general. And so it's important that we maintain attention to who could potentially be under-recognized for the disease and undertreated, so we make sure everybody gets the care that they need.
So what would a patient do if they think they might have long haul symptoms?
Yeah, if you're someone who's had COVID and you're concerned that you're experiencing the brain fog or some of the other symptoms we've talked about that could be part of that, it's important you talk with your physicians about it. We're still learning, so there are ongoing clinical trials that people can participate in or registries that can help not only define therapy for them, but hopefully help in the future.
And I guess the most important question is, how can we avoid getting COVID long haul to begin with?
Yeah, so the easy answer is avoid getting COVID, but how do you do that? You follow the CDC recommendations, you listen to the governor, so that means wearing masks, staying 6 feet apart, not going into large gatherings, washing hands frequently, and if you are sick, to stay home and isolate.
That sounds a whole lot easier than what you've described previously. Well, gosh, thank you so much. This is definitely a question that's been on my mind and haven't fully quite understood it, so I know others have it as well.
Oh yeah, absolutely. Anytime, Lisa.
All right, well, stay safe.
You as well. Thank you.
Thank you. Thanks again, Dr. Laura Gravlin, for helping us better understand the impact of COVID long haul. I have lots more questions, and I'll be interviewing experts in Central Ohio, so look for more interviews to come. In the meantime, just remember, what we do together counts more than ever.